So there are many, many types of toothbrushes that we'll show you. There are regular toothbrushes, three-sided toothbrushes that you can see in pictures 2, 3, and 4. It's a three-sided toothbrush that actually cleans the teeth all at once. You can add certain types of modifications to either a flosser or a toothbrush, such as a bicycle handle that helps improve the dexterity for your residents if they're brushing by themselves. And some of your residents may have an electric toothbrush, or we may recommend an electric toothbrush. It's really important to keep germs from spreading. So keeping each resident's toothbrush in a safe place. It needs to be stored separately from anybody else. And also it's very important to rinse off all that extra toothpaste after each brushing, because it can actually make the toothbrush very hard like stone. Now I'm going to go over the techniques of toothbrushing. The goal is to be very focused in how you brush the teeth. You know, in our office, when I ask a patient to brush their teeth, in 10 seconds, they've brushed the upper right, the lower right. They're all over the place. And so you need to slow down and also be very focused. You want to tilt the toothbrush at an angle, which we say 45 degrees, but it doesn't have to be that particular, but just tilting it up towards the gum on the top and tilt it down at the bottom. And we'll show you in this demonstration. You want to go back and forth or a circular motion, whatever you feel more comfortable with, but really making sure that you're at the gum line. And we want to emphasize that bleeding is okay. If you see bleeding when you're either brushing or flossing, do not stop, either for yourself or for your residents. The bacteria is actually coming out of your mouth, and I say it's a way of it's your body thanking you for taking good care of it. So in about a week or so, with better brushing and flossing, that bleeding should stop. However, in the beginning, when you're improving your technique, the bleeding is okay. We're gonna start baby steps by brushing just the top teeth and just the bottom teeth. So you want to brush the outside where the teeth and the gums come together on the top upper, and you can see the toothbrush is up at an angle at the gum line, and you'll go back in a circular motion. You can count to 6. 1, 2, 3, 4, 5, 6. Then you have the toothbrush out of the mouth, as you can see in the picture on the right, on the inside, and you can count 1, 2, 3, 4, 5, 6. It's going to sound very repetitive, but we're really trying to be focused and slow and efficient. Next, you'll brush the bottom teeth. Where the teeth and the gums come together, you can see the toothbrush angled at the gum line, and you can count to 6 on the outside and then on the inside. Then you want to be really focused about the next steps. And don't worry if you can't get to the back teeth just yet with your resident. Our goal is to help you progress over time. So we want you to think about each section of the mouth as a corner of the mouth that you're going to take the time and brush all of the teeth in that area before moving to the next area. So you'll start in the upper right. And I always tell my patients the 3 things you need to remember is outside, where you chew, and inside. So as you can see, outside, where the teeth and the gums come together, counting to 6. 1, 2, 3, 4, 5, 6. Where you chew, 1, 2, 3, 4, 5, 6. And on the inside, counting to 6 again. Then you'll move to the upper left. Same thing. Outside, where you chew, inside. Taking your time and doing the best you can, and Deb will go over all of this with you with Mark. Next, moving to the lower left. Outside, where you chew, and inside. And then making your way back to the other side, brushing the lower right, outside, where you chew, and inside. And so when do you replace toothbrushes? So when a toothbrush looks like this, frayed and worn, it's time to replace it. Typically we say every 3 to 4 months when the bristles become bent or frayed, but if it happens that the toothbrush looks frayed before that period of time, please have it replaced. Toothbrushes should also be replaced after any illness, so really trying to make sure that the toothbrush is soft, flexible, and new.